السلام عليكم ورحمة الله. Uh, Today, inshallah, we are going to present very important part, uh, which is about the imaging of the head by CT in emergency. Why? What is the value of CT head in case of emergency? This CT play very important role in assessment of emergency conditions uh, in emergency conditions. This, as you know, CT consists of section starting from the base of the skull up to the vertex. We are going to take slice after slice, section after section, to cover all these points, to cover all these parts. So the section appear like this. The first section, the second, the third, and fourth. The anatomy is played according to the level of the section. Sometimes you can see the ventricular system, sometimes you can see this brain stem, sometimes you can see only the lobes, according to the level of the section. Also, it is very important to know the space anatomy. All of you know that the brain is covered by a meninges called diameter. Diameter is the meninges that covering the brain. Then there are other two layers of meninges. The second one is arachnoid, and the third one is the durameter. So this is the skull, calvareal skull. The blue is the durameter. The red one represents the arachnoid, and the green is diameter, which is adherent to the brain tissue or brain parenchyma. There are spaces between these layers. There is space between the diameter and arachnoid matter. This is space, and also there is space between the arachnoid matter and the durameter. This is space, and also there is a space between the durameter and the skull calvareal bone. This is space. The space between the subarachnoid, between the diameter and arachnoid, is called subarachnoid matter. And the skull between the durameter and arachnoid matter is called subdura. And the space between the durameter and skull is called extradura or epidural space. This is epidural or extradural space. This is subdural space, and this subarachnoid space, and this is the brain parenchyma, and this is the lateral ventricle. These spaces are very important because the blood may be accumulated in these spaces, and we are going to name the hematoma according to the space. So again, this is the calvareal bone, this is the skull bone, this is the epidural space between the durameter and the calvareal bone, and this is the subdural space between the durameter and arachnoid matter, and this is the subarachnoid space between the diameter and the subarachnoid matter, and this is the brain parenchyma. So the blood may be accumulating in the brain parenchyma and on the other spaces. And this is the lateral ventricle. Also, blood may be accumulated in these ventricles. Concerning the technique of CT, the CT consists of multiple axial sections from the base of the skull up to the the vertex, and we have a two window. The first one is called soft tissue window, like this, in which we can see the details of the brain parenchyma. Soft tissue window. And the bottom ones are the bone window, in which you can see the details of the bone, but the soft tissue is not. So this is bone window, and this is soft tissue window. Okay. Soft tissue window is done for the head CT brain in most of the cases, but bone window may be indicated in some cases. It's not routinely done, but it should be done in case of trauma or in case of suspected metastasis to the bone, for more assessment of the bone structure, the calcareous bone. This is done by the computer. You can adjust the window to eliminate the soft tissue or bone window, and also you can uh, uh, take a window in which you can see the details of soft tissue like this. So this is soft tissue window, and this is the bone window. This is bone window, as there is no details of the soft tissue. There is no details of brain parenchyma. You are only see the details of the calcareous bone. So both are the bone window. The there is a there is a depression of the skull. So this is depressed skull fracture. There is a depressed skull fracture. So this is a bone window. Help us in assessment of the bone, especially so this is mandatory in case of trauma for assessment of the bone fracture, as the plain X-ray usually miss many skull fracture. So this is CT window with CT brain or CT head with bone window is mandatory to be done in case of suspected skull fracture. طيب طبعا all of you also know that CT may be done with contrast. This is called non-enhanced CT for the brain مثلا, or it could be done with contrast. This is called contrast enhanced CT. Contrast enhanced CT. For the brain, it's called brain contrast enhanced CT or contrast enhanced CT brain, or brain CT with contrast. يعني المهم نقول there is a contrast, لكن it could be done without contrast. There are many indications for contrast administration, but not any patient require IV contrast. CT with contrast done by injection of contrast medium to make some pathologies more clearly visible. Yani there are many pathologies may be not clearly visible without contrast. So this contrast may help us in administration of many conditions. Also can be used for differentiation between the many lesions. يعني أحيانا بيكون عندنا lesion and we are going to assess the pattern of contrast enhancement. And I think which pattern of contrast is this lesion taking the contrast homogeneously, or takes the contrast with ring pattern, or peripheral pattern, or heterogeneous pattern, or serpiginous pattern. This helps us in assessment or differentiation between the many types of lesion. And also this contrast helps us in administration of the blood vessels like this. Also, it helps us in administration of the blood vessels. This is a circle of Phyllis. You can see the internal cerebral artery and anterior communicating artery, middle cerebral artery in both sides, basilar artery, posterior cerebral artery, posterior communicating artery. So this is a contrast make the blood vessels more obvious and help us in assessment of these blood vessels to exclude arteriovenous malformation, stenosis, or aneurysm. This is a CT with contrast or contrast enhanced CT help us in assessment. Also, CT angiography is, as we mentioned, is help us in assessment of the vascular disease. such as stenosis, occlusion, or vascular malformation. This is CT with contrast. You can see the contrast enhancing the blood vessels. إذا إحنا عارف إنها ذات CT with contrast. You can see the blood vessels enhance with contrast. يعني إيش enhance؟ يعني uptake the contrast and appear as hyperdense. And this is the CT with contrast. Demonstrate how the middle cerebral artery is occluded. This is the normal and this is the occluded. You are not able to see the enhancing right middle cerebral artery. And also this is the right middle cerebral artery is not seen. It is occluded at this point. But the right one is normal, enhanced with contrast. So this is a CTA, CT angiography or CT with contrast is help us in assessment of the blood vessels to exclude any blood vessels abnormality. Also, CT with contrast can be kind of CT, CTA for blood vessels, CT angiography, and this is CT venography. Also for assessment of the venous system, the superior sagittal sinus, the inferior sagittal sinus, the straight sinus, the transverse sinus, the sigmoid sinus. All these sites may be assessed clearly with contrast. يعني نعطي البيشنت contrast بروتوكول معين and we are going to scan the patient in certain time to look to the venous system. And also it may demonstrate the abnormality in the venous system, the superior or inferior or straight or any type of any part of the venous system. Compared to the MR angiography, this CT venography is rapid. يعني معروف إن الCT دائما CT require less time compared to MRI. يعني إذا عملنا MRV or CTV usually take less time. Is rapid technique. And زي ما قلنا هي محتاجة بس لشنو contrast. لابد تعطي البيشنت IV contrast to delineate the venous system. طيب كده خدنا overview about the CT technique. Then we are going to discuss the role of the CT in case of emergency, and we classify the traumatic brain injury into two groups, primary and secondary. The primary include extraaxial hemorrhage, the blood in which the blood carries out the brain parenchyma, out of the brain substance. It occurs between the layers that have been explained. And يعني هي بتكون شنو between the skull and the brain parenchyma. It is outside of the brain parenchyma. It could be epidural when it accumulates in epidural space, or subdural, or subarachnoid hemorrhage in which is the blood seen in the basal cistern and the sulci and the subarachnoid spaces in general. And the primary one also may be intraaxial hemorrhage. Intraaxial hemorrhage or lesion. It could be hemorrhage or contusion, or it could be also in the brain stem, in the bones, or in the midbrain, or the other part of the brain stem, or intraventricular hemorrhage. Intraventricular hemorrhage, some people classify it as intraaxial lesion. The secondary may be due to trauma or diffuse cerebral edema. This is secondary brain trauma. طيب, how the patient with traumatic brain injury present? What are the clinical features? بيجوا بإيش؟ What are the symptoms and signs, the clinical features? This depends on the type and location and severity of the brain injury. يعني إذا كان severe, the patient may be present with complete loss of consciousness, and if it is less, it may be complete with alteration of the consciousness, and also it may be present with hemiparesis, hemiplegia, inability to talk, according to the location and types. of the brain injury. And so it may be present, the patient may present with impaired consciousness, which is common and in severe traumatic brain injury. But when the patient with mild traumatic brain injury, the patient may only present with يعني mild symptoms. طيب نيجي نتكلم عن الهيموريج دي ذاته اللي هي بعد احنا نتكلم عن ال appearance of hemorrhage on CT. فإن البلاد دي either يكون acute blood, acute hematoma, or subacute or chronic. On CT any acute blood appear hyperdense يعني أبيض يكون white on CT. And subacute blood appear isodense. Isodense to brain parenchyma compared to the normal brain parenchyma, and also the chronic hematoma or hemorrhage or bleeding appear hyperdense or plaque compared to the normal brain parenchyma. نيجي نتكلم عن كل واحدة لحالها. نتكلم عن epidural hematoma. زي ما اتفقنا إن epidural hematoma is characterized by accumulation of blood in the epidural space. The classical manifestation of epidural hematoma is an initial loss of consciousness. لكن بيحصل له initial loss of consciousness, then followed by lucid interval. يعني in which the patient become normal, يعني gain normal or near normal consciousness. فدي المشكلة. فحتى الناس بيقولوا لك مثلا والله هو حصل له loss of consciousness لكن الحمد لله بقى كويس. فهي دي تكون اللوسيد انترفال. فهي فسو this should be put in your mind. The patient with epidural hematoma present with loss of consciousness then followed by lucid interval. يعني تكون gain the normal consciousness then followed by rapid neurological decline. يعني بيحصل له rapid manifestation, loss of consciousness, and maybe fits, maybe weakness. طيب what is the source of epidural hematoma؟ دي مهمة جدا. The source of epidural hematoma is 90% from the medial meningeal artery. لذلك هو بيحصل له rapid accumulation لأنه the source is medial meningeal artery arterial. شنو the arterial source دائما بيعطينا blood, very massive blood. So the epidural hematoma is originated from the medial meningeal artery. The most common site may be temporoparietal. This is the most common site for epidural. It appears as biconvex or lens shape. Biconvex or lens shape. Biconvex like this. يعني هي especially the inner margin بيكون convex. واصلا هنا عندك the other side in contact with the skull bone اصلا هو convex. And the inner part is also convex, so it's convex. So it is biconvex. This is the shape of the blood, and it is commonly associated with skull fracture. So it is usually there is a history of trauma. لذلك this epidural hematoma commonly present with skull fracture. How to diagnose epidural hematoma? The patient جاك بالhistory بتاع loss of consciousness after trauma. The non-contrast CT of the head is the imaging modality of choice. You have to do non-contrast. أهم شيء non-contrast, not CT with contrast. But this is CT. This is a diagram demonstrate how the blood originated from the medial artery in case of trauma. You can see there is a fracture in the skull, and this is causing a bleeding from the medial meningeal artery, which appear as biconvex, and this blood accumulates in between the calvareal bone and dura mater. So it occupies the extradural or epidural space, extradural or epidural space. So this is the CT. Demonstrate how this blood or hematoma appear on CT. Anyone to interpret this CT? Reporting, how to report this CT. Yes. Please try to talk and comment. Any volunteer? Yes. Please try to comment. Please try to discover the area of weakness. What is this? What is this image?
CT.
CT of what? CT?
Well,
CT? CT of what?
CT of the brain.
CT brain, with or without contrast?
With contrast, I think. Not without.
Without contrast. CT brain or CT head without contrast. What do you see?
Hematoma.
How to describe this hematoma? What was the appearance of this hematoma?
It's white.
Yes. اللي هي نقول ايش؟ نقول نتذكر white. How to describe white lesion on the CT?
Hyperden.
Yes, there is a hyperdense. What about the shape of this lesion?
Concave.
Concave. ليش concave? Why concave? What is the difference between concave and convex?
لا قصدي convex. معلش تتفهم.
Convex.
convex لأنه صاير كذا منعكس.
Yes, this is a convex يعني محدد. Convex. اللي هي biconvex يعني two other the other side also convex اللي هي contact with the skull and the inner margin also is convex, so it is biconvex. Two margins are convex, biconvex. So there is a biconvex hyperdense lesion in the right head. How about the midline?
It's deviated
Yes.
to the right.
Yes, it's deviated to which side?
Right.
Right. What this side is what? Is that?
This is left.
Left. Usually this is the right. This is the left. As you look to the patient in front of you, this is the left. Usually this is the left. The side against your left side is the right, and this side against your right hand is left. So this is the right, and this is the left. So
Okay.
the midline shift towards the right. With how about the ventricle? The right ventricle.
يعني اليمين صار صغير.
Yes, حصل لي ايش معناتها؟ نقول حصل لي compression. There is a دي كلها بنسميها شنو؟ massive tick. Massive tick characterized by what? Midline shift and compression of the lateral ventricle. The compression of the lateral ventricle or midline shift, this is called massive tick. So this is the characteristic feature of epidural hematoma because it is biconvex. So epidural hematoma, CT head with contrast should be done. The indication is the first line imaging in patient with suspected acute epidural hematoma or extradural hematoma. The first line of imaging should be done CT head without contrast. The features of the hematoma biconvex اللي هي lenticular in shape تشبه العدسة, sharply demarcated, and it is extraaxial. It is not interaxial. It is not into the brain parenchyma. In extradural hematoma almost always بتكون acute. لانه البيشنت عنده سيفير سيمتومز ما بينتظر بيجي ايرلي، لذلك هي دائما بتكون هايبردنس. تذكروا دي دائما اكستراديورال ابيديورال هيماتوما البيشنت بيكون عنده سيفير سيمتومز ما بينتظر عشان يجي لانه حتى يشوف السبديورال البيشنت ممكن يجي ليت، لذلك ممكن تسهر لنا الصف يوضع بورشن كرونيك. لكن this is epidural the patient present early and it require early treatment. يعني دايرة شنو early treatment because it can damage the brain and the patient cannot tolerate the symptoms. And this is a blood is limited by this suture line. This extradural hematoma cannot cross the suture lines. And usually there is a fracture. يعني commonly يكون إنه البيشنت عنده fracture at the site of the hemorrhage. But sometimes CT may be normal، دي هي دي ما common، لكن sometimes may be normal إذا كان حصل delaying of the extradural hemorrhage. مرات بيحصل trauma ما بيحصل ال oozing of blood early، ممكن تعمل CT يعني مثلا تلقاه normal. But لكن after short time this lesion may be quickly expanded in size، بيحصل rapid bleeding and oozing of the blood. أهم شيء نعرف how the characteristic finding of EDH extradural hematoma. أهم شيء biconvex with inner margin convex with denticular shape well or sharply demarcated, hyperdense, does not cross the suture line. So this is CT coronal، واضح هي coronal without contrast، and this is CT axial without contrast. Because these are soft window. ليش soft window؟ لاحظوا إنه البرين parenchyma is clearly visible. But the third one, the bottom, is bone window. This is a bone window. This is a bone window. You can see also the same features اللي هي biconvex. Inner margin is convex، يعني هي two margins are convex، لكن دائما احنا نركز على inner margin لانه اصلا ده معروف. the other line in contact with the skull اصلا هو convex، لكن the inner margin is convex، so it is biconvex or lenticular in shape. ايش واحدة عادية hyperdense cannot cross the suture، يعني السوتشر بتكون adherent to the skull، لذلك ما تقدر to pass through this line. كده خلصنا epidural hematoma or extradural hematoma. نجي للسبديورال. زي ما اتفقنا السبديورال هي the space between the arachnoid and dura. The source of this hematoma is from the cortical bridging veins. لاحظوا هناك كان from the middle meningeal artery، لكن هنا from the veins. لذلك هنا طبعا الفينز البلاد فيها كل البريشر ما بتكون very high، لذلك بتجينا بلاد قليل يعني. إذا so it caused by tearing of the cortical bridging vein. طيب زي ما قلنا in the epidural usually there is history of trauma، لكن هنا حتى إذا كانت التروما بتكون minor trauma. If there is a minor trauma it usually minor trauma، يعني ممكن يكون خبطة خفيفة أو أحيانا even the love كمان in elderly طبعا، يعني tribal injuries حاجة كده أنت ما حاسس بيها خبطة خفيفة. and also it may be occurs in patient with hypertension or coagulopathy. Or this may be risk for the bleeding in subdural space. The shape of subdural hematoma is crescentic in shape. عكس ده كان biconvex. This is crescentic in shape. And the inner margin is concave, not convex. Concave inner margin. زي ما قلنا هو برضه common child abuse اللي هي non accidental injury. يعني ممكن واحد لما يكون child abuse يتعذب ولا كده ولا هي تعرض لتعذيب، it can develop this subdural hematoma. So when we suspect child abuse you can do CT to exclude subdural hematoma and also common in elderly. هناك كان قلنا in epidural hematoma it usually almost always acute for لأنه قلنا زي البيشنت يكون عنده severe symptoms and required early intervention. But subdural hematoma can be acute or subacute or chronic. طيب according to this the appearance will be differ in the CT. إذا كان acute or subacute or chronic, the appearance difference from this in these phases. So this is a bridging vein source of the blood in the subdural space, and this is the blood. This is the blood occurs in this subdural space. This is the subdural space between the dura mater and arachnoid matter. Between the dura mater and arachnoid matter ما بتكون البلاد كثير يعني. This is subdural space due to rupture of bridging veins, not from the arteries. فأهم شيء زي ما قلنا هي عندها concave inner margin. The inner margin is concave or crescentic in shape. This is acute blood. أول acute ليش؟ نحن أي acute blood, any acute blood في all types of the hematoma appear hyperdense. يكون hyperdense. بعدين نشوف الانر مارجين. الانر مارجين هي ايش؟ concave مقعرة. لاحظوا compare هنا كانت محددة convex but in subdural it concave the inner margin. So this is acute subdural hemorrhage. ليش acute? Because the blood is hyperdense. Why it is subdural? Because the inner margin is concave. So this is subacute. So to conclude this, طبعا for any types of blood CT head without contrast should be done. زي ما هسه عرفنا في epidural, also in subdural, and also in the other types of hemorrhage. CT head without contrast, which is the first line imaging modality for suspected acute subdural hemorrhage. طيب what are the manifestation of this subdural hemorrhage؟ زي ما قلنا هي crescent shaped يعني concave inner margin, sharp demarcated distal axillary region. He can cross the cranial suture لكن does not cross the midline, can cross the cranial lines. طيب لما يكون عندنا large unilateral subdural hematoma can cause midline shift. لما قلنا signs of midline shifts, what are the signs of midline shift؟ last week أو الآن برضه مرت علينا. إيش يعني midline shift؟ What are the signs of midline shift or mass effect يعني؟ I mean mass effect, not midline shift. What are the signs of mass effect؟ واحدة منهم midline shift. What others؟ لما نقول there is a mass effect characterized by signs, many signs. It may be midline shift زي دي أو what else؟
compression.
Compression of the lateral ventricles. Yes. What else? Effacement.
Metastasis.
Yes.
Metastasis.
I mean the sign of the mass effect. يعني نعرف إنه there is a mass effect. يعني إنه في lesion عاملة لنا.
Weakness.
Yes.
Weakness.
On the image on CT. يعني إحنا what are the signs of mass effect on CT؟ يعني هسه مثلا هي there is a mass effect. عرفنا كيف إنه there is a mass effect.
بشوف حجم الفنتريكلز.
Yes, there is a compression of the ipsilateral ventricle. الفنتريكل ده compressed. نعرف إنه في mass effect يعني في شيء عامل compression mass effect on the ipsilateral ventricle. And also there is a midline shift. يعني midline structure shifted. يعني حتى الفنتريكل ده مفترض يكون on the right side, shifted to the other side. And also effacement of the cortical side. يعني عندنا الكورتيكال سلساي دي الديبريشن دي فيها سي تي فيها السي اس اف here is not clearly seen لانه حصل لها effacement يعني كانها اتمسحت. دي بنسميها ماسك اتكلمنا عنها الاسبوع اللي ماضي. فسو in the subdural hemorrhage اهم ساين اللي هي عندنا شنو؟ crescent shape concave inner margin sharp demarcated extract زي اللي هي دي اهم ساين to diagnose subdural hemorrhage. طبعا بعد ذاك تشوف انه في midline shift or mass effect or not يعني midline shift or compression of the ventricles or effacement of the cortical sulci. طيب the density of the blood نحن زي ما قلنا السبديورال هيماتوما may be acute or subacute or chronic. زي ما شفنا اذا كانت acute البلاد بيكون hyperdense. طيب how about the blood in subacute؟ اذا كان subacute هيكون البلاد ايش شكله؟ هيكون isodense يعني of similar density to the normal brain parenchyma. لذلك this is very difficult to be diagnosed on CT يعني ما بنشوفه لكن بنشوف الماس effect لكن the bleeding itself is not seen because the density of this collection is similar to the normal brain parenchyma. In chronic subdural hemorrhage the blood appear hypodense. اتفقنا hypodense يعني black, hyperdense white, isodense of similar density to normal brain parenchyma. طيب احيانا بيكون عندك acute and chronic subdural hemorrhage معناتها دي بيكون بياخد التو appearance يعني الهايبردنس اريا بتكون recent blood and the isodense or hypodense areas بتكون شنو older hematoma. This بيسموه acute and chronic hematoma of شنو of two densities. According to my talk how to report this. Yes. This is CT head with or without contrast?
Without.
Without contrast. Bone window or soft tissue window?
Soft tissue.
brain window.
soft tissue window or brain window يعني. طيب what striking abnormality do you see?
There is hypodense lesion
Yes.
in the left side,
Yeah.
and there is midline shift to the right side.
Yeah. How about the inner margin of this lesion?
Convex.
Convex.
Convex. Okay.
concave مقعرة. إذا كان convex كان بتكون محدبة زي العدسة كده لكن concave الانر مارجن يعني داخلة على السكالب concave مقعرة concave دي اللي هي دي المارجن دي. Thank you. Excellent. This is the left hemisphere crescent shape hypodense lesion causing compression of the lateral ventricle and midline shift. Midline shift. This is how. What is the most likely diagnosis?
Chronic subdural hematoma.
Thank you. Chronic. طيب زي ما هي قالت chronic. ليش chronic؟ لأنه the collection appears شنو؟
Because hypodense. That
subdural ليش subdural؟ ما قلنا epidural.
because the concave.
Yes, the inner margin is concave. It's a crescentic in shape. It is not in 24 on. It is thank you. Excellent. Anyone to report this also? What is this? What is this image?
Was it CT?
CT. What for which part? CT what? CT
Soft
chest?
tissue window.
Yes, CT soft tissue window of what? CT chest
Brain?
or CT? CT head or CT head, soft tissue window or brain window. Thank you. With or without contrast?
Without
Without contrast. What do you see?
Midline shift.
Wait, midline shift. This is a midline. It shifted to other side.
the lateral ventricles compressed.
Yes. Like what is أصلا the abnormality? يعني the main or the cardinal abnormality.
There is hypodense and hyperdense.
Yeah.
Hypodense dark in the upper of the image.
Yeah.
It indicates chronic subdural hematoma because it's also concave.
Yeah.
And from the back, it is hyperdense. It's
Yeah.
whiter.
Yeah.
And it's concave, so it is acute subdural hematoma from the back.
Thank you. Excellent. There are bilateral concave inner margin hematoma of two densities. The superior one is hypodense and the inferior one is hyperdense. يسموها sedimentation level. sedimentation لأن البيشنت طبعا بنعمل السي تي ويكون on his back. لذلك الأكيوت بلاد حصل له شنو dropping to the bottom and this is the chronic blood. But this is acute and this is chronic blood. أول قلنا دي chronic ليش؟ لأنه hypodense and this is acute because it is hyperdense. Why subdural? Because the shape is concave inner margin crescentic in shape. So this is acute and chronic. Usually on bilateral subdural hematoma there is no midline shape لأنه دي بتعمل compression من the side ده ودي بتعمل من the other side. لذلك the midline structure will be in place. لكن إذا كانت unilateral usually there is a midline shift. لكن in bilateral subdural hematoma usually there is no or minimum midline shift. يعني كل واحدة بتعمل shifting to the other لذلك all the structure will be in place. Try to conclude this. So this is acute subdural hematoma. Why? Because it's concave inner margin. هنا في بلاد طبعا دي السكال لكن في بلاد هنا density بتاعته hyperdense with concave inner margins with midline shift. So this is acute subdural hematoma. And also there is a chronic blood here with crescentic in shape or concave inner margin, hypodense. So this is chronic subdural hematoma. In this one, do you see any abnormality in this one?
Yes, there is shifting.
Yes,
But
thank you. There is only shift. So what this is the
it is
this mean what?
subacute isodense.
Yes, thank you. So there is a blood here which is subacute. ليش ما مبين? Because it is isodense to brain parenchyma. الحين هنا في blood لكن ما ظهر لك hyperdense ولا hypodense because it is of similar density to the brain parenchyma. لذلك ما بين. لكن هي زي ما قالت عرفت كيف؟ Because there is a massive effect, there is a midline shift and compression of the lateral ventricle. فده الشخص بيعرف انه there is abnormality here making this. ليش حصل compression؟ ليش حصل midline shift؟ Because there is blood here but we are not able to see it because it is of similar density to this, the brain parenchyma. So this is called subacute memory. Yeah, this is a comparison between the subdural hematoma and epidural hematoma. Epidural is biconvex, lenticular in shape, and this is a concave inner margin, crescentic in shape. And دي ما قلنا almost always بتكون acute لكن دي could be acute, subacute or chronic. دي زي ما قلنا does not cross the suture line but this can cross this suture line لكن this cannot cross the line. لكن this can cross the midline. This is usually associated with trauma. Here there is no history of significant trauma or minor trauma. The source of this one, source of the blood, is the middle meningeal artery, and in here is from the bridging vein. طيب نجي للسبركنويد hemorrhage. Subarachnoid is often caused by trauma, but it also can be due to non-traumatic cause such as rupture of aneurysm. In non-traumatic subarachnoid hemorrhage, the patient usually present with sudden and severe headache. يعني إذا البيشنت عنده sudden and severe headache, tubing headache، يكون كأنه يعني very severe pain, may be accompanied by nausea, vomiting, and loss of consciousness. This is concerning the clinical presentation of subarachnoid hemorrhage in non-traumatic. طبعا in traumatic هيجيك ب history of trauma involving road traffic accident. But in non-traumatic the patient presents with severe headache. أهم شيء الهيديك ده بيكون very severe and sudden. طيب هنعرف إنه السبارachnoid hemorrhage كيف؟ أصلا هو hemorrhage in شنو؟ in subarachnoid space. So إحنا عارفين normally the CSF. How the CSF appear on CT normally? How the CSF appear on normal CT? كل لونه إيش؟ CSF. Yes.
Hypodense.
Hypodense. Compact hypodense. But in subarachnoid hemorrhage, the CSF becomes hyperdense. يعني احنا عارفين ال CSF بيكون in the basal system, in the ventricular system, in the sulci, and in the fissures. This hyperdense, the CSF become hyperdense instead of hypodense. وليش بقى hyperdense؟ لأنه أي acute blood بتكون hyperdense. وهي السبارachnoid hemorrhage دايما acute برضه، ما عندنا منها chronic، لأنه برضه البيشنت طبعا بيجي early. But this is the blood in the basal cistern and sylvian fissure, and this is the sylvian fissure and the basal cistern and the sulci. So this CSF becomes hyperdense. لاحظ هنا in the ventricle ال CSF اللي هو black، لكن الطرد ده برضه يكون black in the basal cistern and the sulci. المنطقة دي كلها بقت بيضاء due to شنو blood circulating in the CSF. لذلك بقى شنو this is شنو subarachnoid hemorrhage. So this is CT without contrast demonstrate high attenuation. high attenuation يعني hyperdense. ممكن تقول high attenuation or hyperdense blood in the basal system زي دي السيستين عندنا ماني سيستين دي أو in the sylvian fissure. This is a sylvian fissure, or in the sulci. This is blood in the sulci, and this is a subarachnoid hemorrhage. So subarachnoid hemorrhage characterized دي مهم جدا لأنه emergency وكلها emergency، لكن this is a top emergency. إذا subarachnoid hemorrhage to assess by CT without contrast زي مثل كل الهيموريج اللي اتكلمنا عنها. Any patient suspecting subarachnoid hemorrhage, CT with head without contrast should be done for all patients suspected acute subarachnoid hemorrhage. The manifestation of the subarachnoid hemorrhage on CT appear as blood in subarachnoid space. لذلك بيكون شنو؟ بيكون hyperdense. بيكون ايش؟ hyperdense instead of hypodense. البلد ده بيكون hyperdense لأنه acute blood. And this البلد may be extended into the ventricle. Sometimes could be extended to the others, especially the ventricle. طيب هل هنعمل CT ونكتفي ولا في other technique or imaging should be done؟ أحيانا ممكن نحتاج نعمل CT angiography زي ما اتفقنا. CT angiography CT with contrast indicated in patient with negative CT head who decline or have a contraindication to LB. يعني ايش؟ يعني مثلا patient عملنا له CT هو عنده features of subarachnoid hemorrhage present with sudden severe headache and signs of irritation of the meninges. يعني يكون عنده neck pain and rigidity of the neck. فعملنا CT head كانت normal، لكن in this time you can do شنو CT angiography to assess the blood vessels, or if the patient deteriorate. يعني هي كانت يعني عملنا CT حتى لو كان positive البيشنت deteriorating or declining, also this is is an indication for CT with contrast CT angiography. اذا كان البيشنت طبعا هنا بنعمل له LB diagnostic LB، يعني نحن بنعمل insertion of the needle to see if there is a hemorrhage or not. إذا نحن البيشنت اذا كان هو suspected subarachnoid hemorrhage وكان very ill or deteriorating or negative CT، هو مفترض احسن نعمل له diagnostic LB، يعني can insert the needle to see the blood in the CSF. إذا كانت في contraindication to LB ممكن نعمل CT angiography. يعني هي the next step is دائما نعمل LB، لكن if it is contraindicated you can do the CT angiography. طيب إذا كان اضطرينا عملنا CT angiography what are the manifestation of subarachnoid hemorrhage؟ You can see the aneurysm. احنا زي ما قلنا ال cause of subarachnoid hemorrhage may be rupture aneurysm. ممكن تشوف الانيوريزم يكون as accumulation of contrast, circular area of contrast, dilated part of the vessels, or you can see extravasation of contrast. إذا كان حصل rupture وفي active bleeding، هتشوف البلد، هتشوف الكونتراست outside of the blood vessels، يسموه extravasation، presence of contrast outside of the blood vessels اليومين. And you can see vascular abnormalities such as arteriovenous malformation. All this may be demonstrated by CT angiography. إذا اضطرينا عملنا CT angiography this sign may be seen، يا aneurysm يا extravasation or arteriovenous malformation. يعني هي vascular abnormalities ممكن تكون aneurysm or arteriovenous malformation. طيب نحن عارفين انه زي ما اتكلمنا in the introduction لو تذكروا عندنا تكنيك اسمه digital subtraction angiography، زي ما قلنا برضه هو gold standard for arterial diseases. يعني الان بنتكلم عن cerebral vessel imaging is the gold standard. تكلمنا عن how to be perform this digital subtraction. طيب this is a digital subtraction angiography يعني usually done when the CTA is insufficient، يعني to plan intervention، لأنه طبعا عارفين إنه لأنه هي invasive imaging technique. الديجيتال subtraction محتاج لكاتيتر وإنسيجن، يعني هو يعني invasive technique. الفايندنج بتكون نفس دي، ممكن تشوف aneurysm or contrast extravasation or the arteriovenous malformation. So to conclude this slide, any patient presents suspected subarachnoid hemorrhage, you have to do CT. إذا كانت demonstrates the subarachnoid hemorrhage اللي هي as a blood in the subarachnoid space، بعد نبدأ المانجمنت. لكن إذا كانت normal أو كان بنعمل LB او كان البيشنت ديكلايننج وهو highly suspicious of subarachnoid برضه نعمل LB. if LB is contraindicated بنعمل CT angiography بنشوف الساينس اللي هي ممكن aneurysm or arteriovenous malformation or extravasation of contrast. احيانا ممكن نعمل digital subtraction هي مع انها هي الجولد ستاندرد، لكن دائما ما بنبدا بها. ليش؟ لانها هي invasive imaging technique، دايره intervention كثير، دايره required incision, guide wires, catheter. يعني هي very invasive imaging technique, although it is a gold standard for demonstration of the blood vessels. This is CT without contrast. You can see acute blood in the شنو in the brain parenchyma. So this is intracerebral hemorrhage. This blood is seen within the brain parenchyma. So this is intracerebral hemorrhage as hyperdense, appear as hyperdense. And also there is a midline shift. And also there is blood in the lateral ventricle. This is blood in the lateral ventricle. Also this is the blood in the brain parenchyma. لكن this is within the lateral ventricle. Lateral ventricle مفترض يكون لونه black and few CSF. لكن now it becomes hyperdense. So this is intracerebral and intraventricular hemorrhage with massive tip or uh, midline shift and compression of lateral ventricle. عندنا إديمة. الإديمة هي طبعا فلويد، لذلك عندنا بيري فوكال برين إديمة. المنطقة السوداء حول الليجن دي يسموها شنو برين إديمة. These are برين إديمة. Also this is a CT without contrast. You can see the blood hyperdense in the basal system and in the fourth ventricle. So this is subarachnoid hemorrhage. إذا عرفنا دي intracerebral and intraventricular. لكن this is subarachnoid hemorrhage. إذا بنسمي البلد الهيماتوما أو الهيموريج according to the equation. So where is the blood in this one?
Intraventricular.
In which ventricles?
Lateral.
Lateral and what is this?
Oh, third ventricle.
And third ventricle. And this is the blood in which one?
Duct of Sylvius.
In the fourth ventricle. Is this acute or subacute or chronic blood?
Acute.
Acute, because acute blood is usually hyperdense. This is acute blood. Like, how to interpret this CT? Just try to talk. Make a trial, please. Try to comment.
Hypodense. Isodense.
Isodense, you are right. But please try to report the CT. You are right. This is one of the findings. But what?
CT head without contrast.
Yeah. There is a.
Deviated to the left.
Yeah, there is a deviation to the left. يعني نسميها ايش قلنا دي؟ الديفيشن ده بسميه ايش قلنا؟
midline.
midline shift
Compression.
and compression of the lateral ventricle مع بعض كده نسميه ايش كله؟ mass effect. Where is the lesion?
In the right.
In the right. Do you see it?
It is isodense.
It is isodense. There is a lesion here. There is a blood here. We are not able to see it because it is isodense. الحين هنا المنطقة دي فيها blood. لكن it is not visible because it is of similar density. احنا زي ما عارفين الضد يصهر حسنه ضده. لكن ديل الاثنين زي بعض. ما حنقدر نعرف انه ما في يعني اذا في منطقة سوداء وبيضاء بتقدر تعرف الديفرنس. لكن all these parts اللي هي الابنورمال والنورمال كله of similar density. So there is no this lesion is not visible. So there is a isodense lesion evident by what? By mass effect اللي هي characterized by midline shift and compression of the lateral ventricle. What is this image?
MRI.
MRI. Which sequence? Sequence.
Third cell.
T1.
T1 sequence اللي هي T1 T2 clear. This is sequence is T1 which plane or section يعني. Is it sagittal? Is it sagittal or not?
No.
What is it?
Transfer. Then
Transverse or axial? How to describe this abnormality? This is for the same patient. Yes. Please try.
Can you repeat the question, doctor?
How to report this MRI? لما قلت هي MRI T1 axial brain. How to report it? Or what your findings? Or how to describe the abnormal?
Concave.
Yes?
hyper intense.
Yeah, thank you. Concave hyperintensity. Right side.
In the right side,
Yeah.
and it is concave.
Yeah. So طيب إذا كان عملنا T2 حيكون الليجن حتكون ايش؟ لو تتذكروا السباكيوت بلاد بتكون ان T1 كيف وان T2 كيف؟ قلت لكم دي الوحيدة اللي تحفظوها سباكيوت بلاد or subdural subacute blood appear hyperintense in T1 and also hyperintense in T2. يعني إذا عملنا T2 برضه also حتكون hyperintense. So this is subacute subdural hematoma which is concave. أهم شيء الشيب بتاعه كان in CT or MRI بيكون concave inner margin eccentric shape. In MRI بنسميه hyperintense. On T1 it appear in hyperintense or of high signal. إذا عملنا T2 also حتكون نفس الشيب دي ونفس الانتنسيتي لأنه السباكيوت blood appear hyperintense in both T1 and T2. نتكلم عن stroke which is defined as sudden or focal neurological deterioration due to disturbance in blood supply. It may be due to cerebral infarction or intracerebral hemorrhage or subarachnoid hemorrhage. The causes of intraparenchymal bleed or hemorrhagic stroke may be traumatic or non-traumatic, may be spontaneous or due to trauma, may be due to hypertension, vascular malformation, arteriovenous malformation, coagulopathy. Some drug may cause this hemorrhage or and then many tumors may be bleed and also the trauma. But any patient with acute stroke, the initial imaging study should be done. دايما برضه نعمل شنو CT without contrast. ليش؟ لأنه CT ده هو شنو؟ take less time, rapid imaging technique and help us in exclusion of hemorrhage. And it is also high sensitive for acute blood. As we know, the acute blood usually in any types of bleeding appear hyperdense or of high attenuation. Hyperdense or of high attenuation. طيب when we need to give the patient contrast إذا patient بستروك وإحنا متى نعطيه contrast إذا كان الكوز may be a tumor bleeding from a tumor or arteriovenous malformation. patient جاب acute stroke وعندنا suspicious of tumor bleeding from a tumor or arteriovenous malformation. This is an indication for contrast. لكن إذا ما عندنا السسبشس دي ما بنحتاج ل contrast. This is a blood acute blood. أول شيء أي blood بيكون hyperdense بيكون شنو high acute blood. But this is acute blood into the brain parenchyma. So this is intracerebral brain blood or hematoma or bleeding. لاحظوا عندنا شنو edema around the lesion. الهايبودنسيتي دي edema طبعا edema يعني فلويد، الفلويد دايما بتكون زي السي اس اف مثلا، الفلويد بيكون بلاك، اي any fluid appear hypodense. So this is a perifocal brain edema, and this is acute blood intracerebral hemorrhage with midline shift and massive effect يعني midline shift and compression of the lateral ventricle. Also, this is CT without contrast. You can see there is a acute blood in the area of the basal ganglia with the mild massive effect. نلاحظ الليفت ventricle is compressed compared to the other one, يعني there is a massive effect. So this is acute intracerebral hemorrhage. Acute لأنه البلاد hyperdense. Intracerebral لأنه within the brain parenchyma, it is not in the ventricle or subarachnoid or يعني or extra cerebral، يعني ما موجود in the subarachnoid space or subdural space or extra intracerebral. Also, this is the intracerebral hemorrhage with extension to the right anterior horn of the right ventricle. There is extension of this blood into the ventricle. So this is intracerebral hemorrhage with extension into the the lateral ventricle. طيب نتكلم عن الاسكيميا، الانفاكشن يعني ischemic stroke, which is a kind of stroke occurred due to impairment of the blood supply to the brain. This is cerebral infarction, usually more common than the cerebral hemorrhage. It accounts for 80% of stroke. The patient usually presents with sudden focal of neurological deficit, beginning with weakness, right or left, paralysis, paresthesia, or aphasia. في other sign، لكن this is the most common sign اللي هي neurological deficit. طيب how to diagnose this cerebral infarction؟ أول شيء لازم نعمل non-contrast CT. Any patient with suspected acute stroke, you have to do CT without contrast. ليش؟ to rule out intracerebral hemorrhage زي ما قلنا قبل شوية. And also it may diagnose some conditions that mimic stroke. ممكن يكون في tumors. And it can also diagnose the stroke if present earlier. طيب مشكلتنا احنا السي تي الابيرنس بتاعت ischemic stroke differ from time to time. فالthe findings يعني بتختلف من شنو according to the time. This CT may be normal or show changes on different times. فلذلك نشوف in مثلا in less than 2 hours، يعني after 2 hours of the event, usually the CT usually normal, no signs of infarction are visible. دي مشكلة طبعا. لذلك لو في واحد فيكم متذكر what imaging or the imaging methods help us in detection of early infarction from the last lecture. طيب هو MRI methods، لكن اسمها ايش؟ قلنا very sensitive for detection of early infarction. كده انتم تكونوا عارفينها لانه هي بتفيدنا في حالة الستروك early stroke. يعني السي تي حتكون نورمال والبيشنت عنده symptoms raising the possibility of infarction or ischemia, brain ischemia. Try to go and read about it اللي هو تعرفوا ايش اللي هي which methods help us in early detection of infarction. اهم شيء انه زي CT.
Weighted imaging.
Yes.
Is it diffusion weighted imaging?
Diffusion again. Yes. Okay.
Is it diffusion weighted imaging?
Yes, diffusion weighted imaging. Yes, you are right. Thank you. Thank you. Diffusion weighting imaging. إذا CT may be normal in less than 2 hours or within 2 hours of after the event. But in the large artery occlusion they may be sign بتساعدنا كثير جدا يسمها hyperdense artery sign according to occluded artery. it may usually seen in the middle cerebral artery or in the basilar artery لأنه دي larger artery. But this is the early signs of the infarction of CT. اسمها hyperdense vessel sign اللي هي بتكون الفيزل بيظهر لنا hyperdense the occluded vessels. هنجي نوضحها برضه. طيب in between 2 to 6 hours after event in some cases there may be edema cytotoxic edema اللي هي edema due to infarction or hemorrhage بيسموها cytotoxic edema هنيجي نتكلم عنها. After between 12 to 24 hours الآن حتظهر لنا شنو الليجن ذاتها حتبقى hypodense البارينكيما infected area تبير hypodense. Then after 3 to 5 days after event بتكون لنا more بيظهر لنا الليجن بتكون more organized بتبقى more hypodense and there is maybe max more edema and more mass effect يعني نلقى mass effect compression and midline shift. After 2 to 3 weeks بتبقى لنا subacute infarction بتكون شنو isodense to hypodense يعني تكون of hypodense or isodense. On chronic infarction بيكون شنو hypodense بيكون very black كمان hypodense بيكون well demarcated with negative mass effect. نجي نوضح الآن negative mass effect by the imaging. So infarction أول شيء تعرفوا infarction is the hypodense lesion. يعني usually hypodense sometimes السبacute بتكون isodense لكن most of the infarction is hypodense بتكون of low density of low attenuation. والinfarction it could be acute, subacute or chronic. دايما follow the vascular territory according to the affected vessels. عندها cortical distribution. It is confined to the cortex. الكلام ده كله نوضحه practical. This is CT without contrast. You can see the dense vessel sign. This is the middle cerebral artery. البيشنت ده عملنا له CT ما ظهر لنا إلا this sign. sign دي بتساعدنا جدا إنه to detect early sign of infarction. This is an early sign of infarction. Middle cerebral left middle cerebral artery dense sign اللي هي شنو acute infarction with characterized by this sign. High middle cerebral artery hyperdense sign. and عملنا سي تي بعد ذاك بتيجي تشوف لك بتظهر لك شنو الهايبودنسيتي دي. لاحظتوا المنطقه دي بقت شنو هايبودنس. This is a hyperdense middle cerebral artery sign in early stroke. This is CT without contrast. You can see this hypodensity of cortical distribution. لاحظوا ملصقه هنا adherent to the cortex, cortical distributed. Follows the middle vascular territory. يعني هي follows شنو مثلا دي area of supplying by the middle cerebral artery and part of by the posterior cerebral artery. This is due to middle cerebral artery occlusion. There is a massive compression of the lateral ventricle and midline shift. أهم شيء إنه هي شنو hypodense with cortical distributed. Also this is a hypodense cortical distributed with massive effect. Cortical hypodense cortical distributed يعني adherent to the cortex. Hypodense, all these are infarction and all infarction appear hypodense compared to the normal brain parenchyma. Also this is a hypodense. This is CT for the same patient which is done earlier. يعني there is a subtle يعني تحس انه في المنطقه دي slightly hypodense لكن it can be past normal. لكن this CT done later after 72 hours is demonstrate well organized infarction. بقت clearly defined, well demarcated hypodensity. This is infarction. This is a infarction, acute infarction. ليش acute infarction? Because there is a midline shift or massive effect of compression of lateral ventricle. This is also acute infarction. ليش acute infarction? Because it is a hypodense confined to the اللي هي cortical distributed with massive effect. دائما in acute infarction بيكون هو hypodense لكن عندها massive effect. يسموه positive massive effect لأنه هنتكلم بعد شوية عن النيجاتيف. This is positive لأنه عامل compression of the lateral ventricle midline shift. This is a positive massive effect. hypodense lesion with massive effect. And also this is a hypodensity cortical distributed, but there is no massive effect. يعني the lateral ventricle and midline shift are in places. ما في compression على الفنتريكل اللي والميدلاين structure in its normal position. لكن عندنا cortical distributed hypodense. فلما ما يكون عندنا massive effect وعندنا hypodense with cortical distributed دي بنسميها subacute infarction. It's so subacute characterized by نفس الفيتشرز بتاعت الانفاكشن لكن there is no massive effect. لاحظوا ان acute infarction كان عندنا شنو positive massive effect. In subacute there is no massive effect. In chronic infarction اول شيء عندنا ال hypodense lesion with cortical distributed لكن عندنا negative massive effect. ايش negative؟ Instead of compression of the lateral ventricle هو بقى dilated. فده بسموه negative massive effect due to gliosis or vacuum dilatation. بيسموه vacuum dilatation. لاحظوا ان الفنتريكل lateral ventricle instead to be لا normal لا compressed, it is dilated. So this is called negative massive effect. So chronic infection characterized by hypodensity with negative massive effect. Subacute characterized by hypodensity without massive effect. Acute characterized by hypodensity with positive massive effect. إذا to differentiate between the chronicity of the infection, we depend on the massive effect. Is it present or not? Is it positive or negative? What is this sign? This sign دي قلنا ايش اسمها؟ لأنه مهمة جدا this sign.
dense artery sign.
This dense artery sign. Which artery is involved by this sign? What is this artery? After the which is this one? What is the name of this artery? What is the lateral branch from the medial cerebral from the internal carotid artery? This is the medial cerebral artery. Also, there is a dense artery sign. What is this sign? What is this artery? ايش ده artery? عرفنا ده this is a left medial cerebral artery, which is a branch of the internal carotid artery. running laterally كده. طبعا هو من
middle cerebral artery.
This medial cerebral artery. Which one is this?
Basilar artery.
This is a basilar artery. So in the early ischemia, brain ischemia, you can see this is the early sign. اللي هي dense artery sign. يعني appear very dense. This is a medial cerebral and this is a basilar artery. هنتكلم الحين سريع عن بعض ال special types of infarction. دي كان مرة بين المرة فاتت lacunar infarction. لما نقول lacunar infarction معناته very small infarction less than 1 centimeter, usually seen in the subcortical arteriosclerosis, small vessel disease. But this is a small infarction in the thalamus, and the right thalamus, and this is a bilateral lacunar infarction. إذا lacunar infarction means very small infarction اللي هي تكون less than 10 mm or 1 centimeter. Brain edema. Brain edema طبعا fluid retention. عندنا 3 types of edema. Cytotoxic edema مرت بينا قبل شوية إنه cytotoxic edema إذا edema occurs around the infarction and hemorrhage يسميها cytotoxic edema. طيب بتظهر كيف زي cytotoxic edema؟ بتكون as a rim of hypodensity. بتكون حوالين شنو الانفاكشن أو الهيموريج. This is a شنو rim of hypodensity around the infarction or hemorrhage. This is a cytotoxic edema, and it can involve gray and white matter. This cytotoxic edema. عندنا other types of pathogenic edema. Pathogenic edema اللي هي edema occurs around the space of pupil lesion, around tumors, abscess, يعني specific by lesion، فدي بنسميها شنو pathogenic edema. it involve only the white matter، لذلك هي بيسموها بتكون عندها appearance بيسموه finger like appearance، لانه it involves the white matter with sparing of gray matter. الجراي matter بتكون شنو not involved، لكن involves the white matter. ان شاء الله هنوضح لكم in the image next image. very ventricular edema من اسمها around the ventricle due to oozing of the blood. يعني مثلا patient with hydrocephalus بيحصل oozing of the CSF in the periventricular space بيسموها شنو؟ بيسموها periventricular edema. this is a site. طيب anyone to comment on this CT? This one. What are your findings? What do you see? نفس الأشياء كنا نتكلم عنها الحين إن شاء الله.
Positive sign.
Try to يعني to report يعني what are your findings or to report. يعني تخيل كانوا مثلا عندك سي تي بتقول this is أول تتكلم عن التكنيك what is this is مثلا MRI كذا أو chest X-ray shows or demonstrate كذا وكذا findings. يعني try to talk about how to describe the abnormality. What is this image?
CT brain window.
Yes, with or without contrast. Without contrast, axial
Without
or
contrast.
sagittal. Axial or cross sagittal. Is axial. What do you see, طيب?
دكتور هنا في dense artery sign.
Yes. No. Then where is the artery that appear hyperdense? Where is it? You mean this?
Yes.
This is a calcification in the choroid plexus. Normally, اللي هي choroid plexus الموجودة in the ventricle can be calcified. دي. This is normal calcification, physiological calcification. لكن this is not area of the artery. Artery يعني this is a normal position of the artery. This is a calcified choroid plexus. But what is this? ايش ده؟ شكله ايش طيب؟ To describe this according to CT terminology. يعني is it hypoechoic? Am I right?
No.
No.
Hyperdense.
Hyperdense. Where is it? وين شايفين الحين دي؟ Is it in the ventricle or
Ventricle.
in the brain parenchyma? This is a in brain parenchyma. And you can see also there is a hyperdensity in the within the what is this? ايش ده؟ اللي هو ايش ده؟ What is this structure? ايش ده؟
Lateral ventricle.
Lateral ventricle. So there is a blood in the anterior horn of lateral ventricle. This is the right anterior horn of lateral, and also there is a hyperdensity in posterior horn of lateral ventricle. So this is acute blood. ليش acute؟ لأنه hyperdensity. So this is acute hematoma, intracerebral hematoma with intraventricular extension. And if you look around this hyperdensity, لاحظ إنه في إيش هنا جنب البلاد adjacent to the blood في إيش هنا؟ في hypodensity. So what is this? إيش دي تكون؟
cytotoxic edema because it's around the hemorrhage.
cytotoxic edema اللي هي edema surrounding the hemorrhage or infarction and هي hemorrhage. طيب also this is a هنا عندنا this is CT with contrast you can see this is enhancing lesion. لاحظوا هنا عندنا برضو edema لكن لاحظوا الإديمة دي involving the white matter الجري matter not involved. لذلك بيسموها شنو كأنها finger like كأنها هي دي finger like with sparing of the gray matter. So this is شنو vasogenic edema. Vasogenic edema is the edema occurs in space pupil lesion مثلا tumors ولا abscess or any space pupil lesion. So this is vasogenic edema. In this one you can see the ventricles are enlarged. There is a hydrocephalus with hypodensity around the ventricle. يعني around the ventricle في hypodensity. This is called periventricular edema. يعني كأنه في fluid oozing around the ventricle. المنطقة دي سوداء شوية كده. إذا مشيت لأي CT أخرى normal ما بتلقى الهايبودensity surrounding the normal. لكن هنا عندنا hypodensity. This is periventricular edema. This is the last slide I think, in which we are going to talk about the brain edema. We mean generalized brain edema. This is called focal brain edema. يعني perilesional edema, hemorrhage or perifaction or peritumoral edema. لكن in this one we mean the generalized brain edema. All the brain tissue in this case will edematous. But so how this brain edema present in CT? You can see there is the absence of sulcal marking. ايش السلكال ماركينج؟ اتفقنا انه هنا في السلسايديه الديبريشن دي الموجود فيها السي اس اف هي السلسايديه هي السي اس اف this is السلكس هي كلها الهايبودنسيتي دي فيها السي اس اف this is السلكس السلساي all this السوداء دي كلها الخطوط دي كلها سلكس. In brain edema there is no لاحظوا هنا there is no sulci. The sulci are phased مسحت absence of sulcal marking and also there is a poor differentiation between white and gray matter. احنا عارفين this is a gray matter and this is a white matter. White matter بتكون black لأنه فيها fat. This is a gray matter. The difference this is the area interface between the gray and white matter. Gray white matter interface. لكن in the case of the generalized edema we are not able to differentiate between the gray and white matter. Poor differentiation between gray ما بنعرف وين the gray and white matter ended. يعني this difference or the area separating between the gray and white matter is lost. So there is poor differentiation white and gray matter. with diffuse brain edema. كل البرين بقى hypodense بقى black due to شنو fluid retention. يعني الفلويد دايما بتكون black on the CT. So the brain edema appear edematous of low attenuation. So this is a sign of brain edema. Have any question?
Thank you, doctor.
يعطيك العافية.
يعطيك العافية.
Now I
عافية دكتور.
want to ask you some questions to answer this quickly. This quiz. What is your diagnosis? Diagnosis only. Hypodense cortical
multiple infarction.
Chronic infarction. This is a infarction. Chronic infarction. This one is more, or also this is infarction. This is a more chronic than this. This is more recent, and this is old. Also, this is a multiple infarction. And what is this? What is the diagnosis?
Epidural hematoma.
Epidural hematoma. Why? Why?
Because
Yes.
because it is convex, the inner margin of the hematoma, and there is midline shifting to the right.
hyperdense, concave inner convex inner margin, or biconvex or lenticular shape with margin.
So it is acute epidural hematoma.
I forgot subarachnoid hemorrhage. Why subarachnoid hemorrhage? ليش ما كانت تكون subdural or epidural or intracerebral? Why it is the subarachnoid? لأنه the blood is seen where the basal cister and the sulci and even in this ventricle. This is subarachnoid hemorrhage. Blood circulating in this, يعني مفترض المناطق دي تكون كلها سوداء due to presence of CSF زي لكن this is subarachnoid. This is the diagnosis.
Chronic epidural hemorrhage.
Acute or chronic or subacute?
Chronic.
Chronic subdural. And this is a cortical distributed, follow the vascular territory. Patient present with weakness,
Infarction.
infarction, yes. And what is this?
Subdural.
Chronic
epidural hematoma.
What is this sign?
Hyperdense.
Yes, this is the sign for acute infarction, and this is the what is the edema? Edema كنت بسميها ايه الإديمة دي؟ عندنا إديمة دي. This is a lesion. هذه دي التيومر ولا lesion. There is edema.
Vasogenic edema.
Yeah. Vasogenic edema. And what is this?
Vasogenic edema around tumor or lesion.
Yes. And this is a
Cytotoxic edema.
cytotoxic. This is because this is a hemorrhage. This is a hemorrhage. Thank you. Do you have any question again?
No, Doctor.
Thank you. يعطيك العافية.
Thank you, doctor.
يعطيك العافية.
شكرا.